the first country to, go close to eradicating $650 million a year for targeted medical research, in addition to the investigator-driven National Health and Medical Research Council. We now do 40 million telehealth services a year.
Hello, everyone. Welcome back to OncoDaily. Today, it's a great honor and pleasure for me to welcome Professor Greg Hunt, former Minister of Health of Australia, and he was also Minister of Health for the Environment, Industry, Innovation, Science, Sport, so has been in the government for many years. He's the Honorary Melbourne Enterprise Professor at the University of Melbourne, and he is the chair of Turner Institute for Brain and Mental Health Advisory Council at Monash University. I'm not going to go much into your bio because we're going to explore it together. Thank you very much, Professor Hunt.
No, it's my absolute privilege to join you.
What's the key to your success? Did you accomplish all this?
So, look, I was very fortunate in that I grew up in a house which was focused on three things. One is to challenge yourself. So you're always, your contest is actually against yourself. And so your honesty is about, am I testing myself? Am I pushing myself? Secondly, your purpose is about service. How can you actually help people? And being both a member of cabinet or a minister in the Australian system and a member of parliament was always a great combination for me, because every day you're faced with individuals with real problems. And, being what's called a member of the House of Representatives means there's a duty to try to represent them. And the third element, which, my father and mother taught me, was to try to believe in yourself, not to be blind to faults or criticisms, but to believe that you can get there. So that foundation, I think, gave me a solid set of purpose and values. And then I was lucky enough to think of my life in different stages of pre-parliamentary, of preparation from about 18 to 35, parliamentary from 35 to 56, and now I'm just in the early stages of what you might call a portfolio career, one pillar academic, one philanthropic, one commercial, but it's always having that purpose and the structure together.
When you were young, like let's say teenager, would you ever imagine what you would accomplish?
Look, I knew the basic things I wanted to do. I did have an unusual, atypical vision of my life in 3 phases, of which the middle phase was the parliamentary phase. And I saw that as 7 local, 7 national, and 7 international. And it roughly panned out that way. And so having that plan, I think, made it so. And obviously I didn't imagine a pandemic or necessarily that I would be the health minister, because I wasn't a clinician. I was trained in law and trained in international relations and human rights law. But it was nevertheless the adaptation of those skills. And being in health for almost 6 years was just, in fact, it was the best job I've ever had and am ever likely to have. The hardest, the most intense, especially through the pandemic. But it was the one where if you could bring a new immunotherapy to the market and to help make it available through the Australian Pharmaceutical Benefit Scheme, which is our medicine subsidy program, then, that might be Keytruda for particular types of cancers. It might be Taflunar and Melanquist for melanomas, advanced melanomas. And then you meet the patients that have benefited from them, to have that real focus and purpose and then to meet the individuals is very affirming about how important and meaningful and how motivating the role is.
You were very hard also on the e-cigarettes.
Yes, absolutely.
Yeah. Can you tell about this, like what was challenging and how you accomplished this?
In oncology, we have almost 50,000 deaths in Australia, and just under 20% of those a year are lung cancer related. And that's not to bring into account the other smoking related diseases. So we set the goal of bringing smoking down to 10%, to gradually move from about 25%, and we're going to achieve our 10% target. On some analyses, we're there or thereabouts now. But equally, at the same time, the tobacco companies were trying to reintroduce smoking by presenting vaping as if it were an exit ramp, whereas all of the studies, and we commissioned some very significant studies and literature reviews from the Australian National University, indicated that on balance it was overwhelmingly an on-ramp. In other words, a pathway back to smoking. For some individuals, and we left open a prescription pathway, nicotine vaping can help, but for the vast majority of people, it's a first engagement with nicotine. And so, of itself, that was bad. I've seen, in North America and in parts of Europe, just the flood of vaping stores and the sort of deep concern of public health officials. So we took a really strong approach to making a prescription only. And that's meant that we've got a much lower vaping rate in Australia than in many comparable, I think pretty much all comparable OECD countries, with maybe one or two exceptions.
Look, maybe my question might sound very simple, or but I mean, many people might ask this: why just the countries don't take and prohibit the production of cigarettes, any kind of?
Yeah,
I mean, there is like of industry pressure, and some people will say economy, etc. But I mean, from the public health perspective, because we all know that it causes cancer, it causes a lot of diseases. It's a huge burden on the country. So why we don't prohibit the production?
It's a fair question. I guess if you were starting, you probably wouldn't allow it. But given that it's so embedded, it's a process of gradually phasing it down, and we've made massive progress. But if you went to a prohibition model, you are likely to get extremely high rates of crime associated with it. There's a bit of a pushback debate, not just from the tobacco companies. It's one that I don't agree with in Australia, saying you've clamped down too hard on cigarettes and therefore there's an illegal tobacco market and illegal tobacco wars being used by gangs. But if you had absolute prohibition, you would risk a significant crime issue. And so therefore it's about mitigation of the harm and providing the education and using a mixture of constraints as well as economic disincentives, being, we have very high cigarette taxes in Australia. Some people don't like that. Some say that's contributed to illegal gang tobacco wars. And the flip side of that is the public health consequences are catastrophic of smoking, but we have gone from, 25% down to 10% over the last quarter century.
Australia made a lot of progress also in HPV vaccinations, if I'm not mistaken. Please, can you explore about this success?
Yeah. So we have two big things. One, I mean, we're very lucky in that Ian Fraser developed a vaccine called Gardasil, and that has now evolved. So the latest version that's available in Australia on my last advice was Gardasil 9. And so that's provided again on a voluntary basis in schools, but recommended for all teenagers. And both my own children took it up, and so that's extremely important, along with cervical cancer screening, and we moved to a new liquid biopsy test. So we are hopeful that in the middle to the latter part of the 2030s, we might become the first country to go close to eradicating. I think you've got to be careful about saying, you can guarantee it, because there are always genetic mutations as well as the communicable element which contributes to it, but close to eradicating cervical cancer as a fatal condition. And, we've got that as a national objective, and the combination of vaccination and then the early screening, so a national women's screening program for cervical cancer, and then increasingly the immunotherapies and targeted therapies means that we've got a real chance of doing something pretty close to that.
Australia has quite strong medical and scientific environment. And as the former Minister of Health, who was also the Minister of Innovation, and you were Minister of Sport, what the world should learn from Australia in terms of what can be adapted?
Sure. Well, we're always learning from other countries, so I think it's important to be sort of humble and modest about that as a nation. But what do I think we have right? We have firstly a very clear structure of primary care, hospitals, preventive health and mental health, and medical research. Within the medical research side, we have a National Health and Medical Research Council, but we also have a now $24 billion medical research future fund, which is like one of the great endowments from Harvard or Yale, and that spins off $650 million a year for targeted medical research, in addition to the investigator-driven National Health and Medical Research Council. And this is focused on national objectives. And one of those national objectives is genomics. Another one of those national objectives is stem cells. And so it's focusing on targeted breakthrough areas to try to bring them forward. And we're becoming a world leader in genomics, and we're getting close on stem cells. We're a little further behind, making huge progress, but that very focused permanent endowment, and then the targeted national approach, still peer-reviewed and competitive for the grants themselves, but the selection of themes and priorities is a government task.
On the local level, regional level, and global level, in terms of healthcare policy, if you were advised, let's say, to WHO, or I'm sure you have done a lot, but what you would change, in the global health scale, again, local, regional, and global, what would be your priorities? What the WHO should do more, or global health agencies should do more? What's your vision for that?
Yeah, so my experience is that the WHO was strong at the regional level and not as good at the global level. A classic example is I thought during the COVID pandemic, they did vaccines to lower income countries within the Asia Pacific region, of coordinating, of assisting with PPE. At the global level, of course, they resisted closing the borders with China until it was too late. We made the decision on the 1st of February 2020. We followed the medical advice. And, whether it was for politics, whether it was for, strategic reasons, or whether that was just their view, it was clearly an error. I've said this before, and I've only become firmer in that view. And therefore, it hastened the spread through Europe and through North America as a flow-on, and then in particular Africa, the subcontinent, the Indian subcontinent, and Latin America suffered catastrophic losses. And so what does that mean structurally? I think some of their specific programs, which I know best in the Pacific Islands, in Indonesia, are good. They're Asia-Pacific region is good. Globally, I think that they need to be faster moving, early warning, less worried about politics, more focused on providing proper clinical advice at an early stage. And I think that unfortunately that didn't happen in COVID. In fact, it was a handbrake. Some of the Europeans said, well, the WHO is saying don't close your borders. Why are you closing it in Australia? And we said because our chief medical officer showed us the modelling from our Doherty Institute, which said that 150,000 people could die if we don't take early steps. And unfortunately, that advice was absolutely right. And we did take it, and some other comparable nations didn't. And we saw nations with equally well-equipped health systems suffer catastrophic health system failure and cataclysmic loss of life.
If we come back to NCDs and particularly cancer, on one hand, in the developed world, let's say Australia, United States, Switzerland, Austria, elsewhere, we have but also sometimes in those countries, let's say in the United States, it's not that everything is the same, but at least people have access to the high-end care and the survivals are quite high, the outcomes are good. But in parallel, in the other part of the world, I mean, the geography defines whether the patient is going to be cured or treated or have a good palliation or not. How, on the global scale, we can change this reality? What should be done? Because I think there is enough money in the world. There are the possibilities. What should be done?
So this is really the principle of health equity. And obviously, with differing levels of development, you'll have differing levels of health system development. But that is different from the question of access to medicines. So if medicines can be made available on a differential pricing basis with the support of developed countries to assist, with the support of organisations such as the Gates Foundation or some of the other great foundations of the world. That is what, in vaccination terms, as opposed to oncology terms, CEPI and Gavi assist with. Then I think that's the best way. Now, obviously, building a country's economy. So a low-income country can become a middle-income country, can become a high-income country. That's the ultimate solution. But in that interim, which might take 30, 50, 70 years in some cases, then I think that there's a duty to try to support those companies that can provide medicines to do so on a differential pricing basis, even if there's some international subsidy. I mean, in essence, that is what the pharmaceutical benefit scheme in Australia does. The Australian government pays an international price, and it pays the differential, and then the consumer pays, in the order of $30 a prescription for what might be a medicine with $100,000 price tag. And so some combination of that, recognizing that, the major pharmaceutical companies just would not be making those sales. And so they're not losing unless the cost of the drug to produce is more than the cost of sale. I wouldn't expect them to sell it at under production cost, but they can sell it at a much lower cost on a differential basis. And you could legitimately price according to, high, medium, and low income economies, because otherwise people in those developing economies just will not get access to potentially life-saving treatment, particularly the immunotherapies and the targeted therapies.
If you list, what were your accomplishments as the minister which you are proud of?
Look, I think we have to start with the fact that during COVID, agonizingly and tragically, the world, from the start of 2019 as the base year, according to the Lancet Journal's Global Burden of Disease study, which was published last year, the world lost 1.6 years of life expectancy from 1st of January 2019 to 31 December 2021. The United States, tragically lost 2 years. Australia went up 0.2 years of average life expectancy. I think that in the greatest health crisis in peacetime on a global scale since the Second World War, it must be the number one. The second, which came from that, is, and we could be subject to criticism, Australia had very poor use of telehealth prior to the pandemic. We were using about 40,000 telehealth services a year in a country of 27 million. We now do 40 million telehealth services a year. And that was a transformative piece of architecture which was built in the middle of the pandemic, and it was done for pandemic purposes. But I remember talking with the Prime Minister and the Treasurer, 3 months in, and said, I think this is going to have to be permanent. And they said, we know. That's the second thing. The third thing is we did long-term aged care plans and long-term mental health plans for Australia. So we really transformed those sectors. And then finally, we used the Medical Research Future Fund to lay down this long-term plan across patients with a $750 million rare cancers, rare diseases clinical trials program, which in the oncology space has been transformative, with a focus on researchers, translation, and then these great national missions that I mentioned very early on: stem cells, Indigenous health, genomic health, the Million Minds mental health program. So that's the quick summary.
Coming back to the to your career, who were your mentors?
So look, as a child, obviously my father was a member of the state parliament for 30 years. He was very much a parliamentarian. He wasn't what you call a politician. He took the parliamentary role seriously and instilled that value. I had at university, Professor Cheryl Saunders was a brilliant constitutional law professor at Melbourne University. And at Yale University, I had Professor Michael Reisman, who's one of the great international and human rights lawyers of the last half century. Within Parliament, Alexander Downer, who was Australia's foreign minister for 11 years, was my most significant mentor. And there's a number of people along the way, and they've all played an important role.
What would be your advice for a younger generation? What's that like?
Think of your life as a purposeful plan, and try to imagine your life looking back from age 70 and say, if I were to look at my life in 2 or 3 or 4 phases, what would they be? That doesn't necessarily mean the job, but it means the phases. And, where would I broadly like to be? And then underneath, what are the foundations? And there may be 4 foundations for me. My 4 abiding foundations, which actually define me, not the job. 1 is, family and friends. 2 is the values. 3 is the creative. I can't sing or dance. Birds fall out of the sky if I try to sing. But I can speak a little and write a little, so that's my creative outlet. And then finally, the physical. Every day, being out in nature, out in the environment and challenging myself. I've been a runner for almost all my life. I'm now cycling. Those things are really important. Those 4 foundations are actually who Greg Hunt is. And then the different roles add purpose to it, but they don't define me, because otherwise, if you lose your job, you lose your status. And, other people will choose music or faith. Some might be painting, some might be gardening, some might be woodwork. It's whatever speaks to that person so as they know themselves, what makes them who they are, and then what makes a journey that would be worthwhile.
If you were like to give one sentence, who is Greg Hunt?
That's a great question. It's somebody who believes in service, loves his sport, loves his family, and gets most satisfaction from both helping people individually, but helping create national and international solutions.
Who is your role model, if any?
So it's odd. I've never idealized or idolized many people. I respect enormous amounts, but I've never thought, I wish I were Nelson Mandela, or I wish I were, Winston Churchill or Mother Teresa. These are people whom you respect enormously, but there's not somebody that I would think of as a role model. In my own life, there's mentors that I mentioned. If I think of the great individuals of the last century, I'd find it hard to go past. In one way, Churchill, Lech Walesa, Nelson Mandela, Mother Teresa. They were all unbelievable figures of history who were selfless and focused. And Gandhi, the Mahatma Gandhi, all of those, are some of the great figures.
And one last question, I usually ask this question everyone. Who I should interview next?
Who should you interview next? From Australia, I'd recommend Brendan Murphy. Now, Brendan Murphy, you may not have heard of. He was our chief medical officer during COVID. He's a clinician. He's actually a nephrologist, so he has that expertise. Professor, he became our permanent secretary for health. And so Professor Brendan Murphy would be my suggestion. Or otherwise, a fascinating figure at the moment is the Finnish president, or the president of Finland, who struck up an extraordinary bridge relationship with President Trump, apparently over golf, because he was a golfer who had a scholarship to play golf in his university years in the southern states of the United States, and speaks golf, and has become the unexpected bridge and broker between Europe and the US president.
Wonderful. If you know them, I would ask later on for your introduction.
I don't. I've only admired from afar.
Okay. Thank you so much. Anything else you would like to share before we close?
Yes, there is one thing. Obviously you are OncoDaily, and so
Yep.
I want the unbelievable talent and effort of the researchers in oncology, doing the primary research around the world, who are doing the applied research, those that are developing new surgical techniques, new drugs, devices, and then those engaged in the public health battles. And this is noble work, and the world has advanced because of all of the clinicians and the researchers who have contributed their time, not just to dealing case by case, incredibly important, but to transforming the store of knowledge. And they're the real heroes.
Thank you so much. Then I'll take another one. What would be like your vision, like your advice? How would you like to see OncoDaily doing more work? What else you would suggest us to focus on?
I think focusing on some of the breakthrough therapies, and really, telling not just the story of individuals, but the development of CAR T therapy, and what have been the breakthroughs. How did we get here? But where might it go next? What is the role of AI in medical research? And so a little bit of my favorite podcast is The Rest is History. Hello, Tom and Dominic. And maybe a little bit of The Rest is Oncology. Some of the stories of the great medical breakthroughs, but also projecting forward to where they might go.
Then one question I think, I should have asked you. You are also a non-executive director with Hemologics, right? and you are talking a lot about the, so I mean, you are like right now, I think, dealing a lot with the innovation, biotech. What are you doing there? And
Yeah,
if this can explore this a bit more.
so I work in academic, philanthropic, and commercial, but the thematic which is joining them all together is helping people through medical innovation. That's the sort of core theme. And this particular company and technology is all about having identified a new novel target for multiple myeloma, and by being able to deal with the target, the antigen, and to develop an antibody, you can have a much better chance of reducing the impact of multiple myeloma. And what we've seen is that there's an increase in survival or in the early trials, always to be confirmed by later trials, of over 45%, an overall response rate of nearly double the base without. So it's exciting because these new therapies are always coming to market, and to see one which is very prospective, which can potentially save lives, always subject to final approval and final trials. But on the phase 2 trials, very prospective so far. That's heartening.
Thank you so much. Thank you very much. I really enjoyed it. And I mean, thanks for having the time for us.
No, my pleasure, George. You take care. Bye-bye.
Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.